Welcome to the training on measuring vital signs. To train caregivers on accurately measuring and interpreting vital signs, including temperature, pulse, respiration rate, and blood pressure, which are crucial for monitoring the health status of care recipients. Regular monitoring of vital signs is essential in assessing the general health of care recipients and detecting potential health issues early. This session will provide you with the skills needed to perform these measurements effectively. Understanding vital signs. Vital signs are critical indicators of a care recipient's current health status. They can signal the onset of a health crisis and help track progress in treatment or recovery. Temperature. A normal adult body temperature typically ranges from 97.8 degrees Fahrenheit to 99.1 degrees Fahrenheit, or 36.5 degrees Celsius to 37.3 degrees Celsius. Pulse or heart rate. The average resting heart rate for adults ranges from 60 to 100 beats per minute. Respiration rate. Normal respiration rates for an adult at rest range from 12 to 16 breaths per minute. Blood pressure. A healthy blood pressure level is typically between 90/60 and 120/80. Measuring temperature. Use digital thermometers for oral, rectal, axillary, or tympanic measurements. It's important to use disposable covers for thermometers and proper sanitation between uses. Measuring pulse. Locate the pulse points on the wrist or neck and count the pulse for 30 seconds. Then multiply by 2 to get beats per minute. Some factors can affect pulse rate, such as exercise, stress, temperature, and medications. Measuring respiration rate. Observe the rise and fall of the care recipient's chest and count the number of breaths for 1 minute. Note any sign of labored or irregular breathing, which can indicate respiratory or health issues. Measuring blood pressure. Use a sphygmomanometer and stethoscope for manual measurements or an automated blood pressure monitor. Ensure the blood pressure monitor is on an even surface. It is important to have the care recipient relaxed and seated during measurements. Make sure the cuff is accurately placed to get a correct reading. Systolic pressure. The upper number, which measures the pressure in the arteries when the heart beats. Diastolic pressure. The lower number, which measures the pressure in the arteries between heartbeats. Interpret the results based on the blood pressure categories. Normal. Systolic pressure less than 120 and diastolic pressure less than 80. Elevated. Systolic pressure between 120 and 129 and diastolic pressure less than 80. High blood pressure or hypertension stage 1. Systolic pressure between 130 and 139 or diastolic pressure between 80 and 89. High blood pressure or hypertension stage 2. Systolic pressure of 140 or higher, or diastolic pressure of 90 or higher. Hypertensive crisis. Systolic pressure higher than 180 or diastolic pressure higher than 120, immediate medical attention is required in this case. Record keeping. It is important to have accurate and timely documentation of all vital signs in the care recipient's health record. Alert healthcare professionals about any vital signs that are outside the normal range or if there are significant changes from the baseline. Thank you for completing vital signs measurement training. These measurements are a fundamental part of care recipient care, providing essential data that guide clinical decisions and interventions. Your accuracy and diligence in this task can make a significant difference in care recipient outcomes.